And so you can still use two hands, either rest the client's hand on your hip, or you can rest their elbow on the bed. This will allow you to use both of your hands to drain the lower arm, starting at the wrist, working towards the cubital lymph nodes in the elbow, and using both hands in a light but equal pressure. If the client was unable to lie in a prone position due to surgery, we can still drain the leg. We raise the knee, place our hands at the back of the upper leg, making sure our hands or fingers touch and we have even contact and pressure. Drain the back of the upper thigh, sweeping around towards the inguinal lymph nodes at the top. In the lower back area, if there was a surgical incision, we would be unable to drain forwards to the front of the body, so therefore we find an alternative. In this manner, we can drain through the lumbar lymph nodes towards the sacral lymph nodes as an alternative to draining towards the front where the inguinal lymph nodes would be.